Hi everybody, Fletch, nurse practitioner at SAP Health here. Going to show you how to reconstitute or draw up or mix some medications that you got just in the mail from our pharmacy. Depending on the medication, it can be different amounts, so these aren't standard amounts for every single medication, so you want to follow the directions exactly. Going to show you about these medicines, which one and how to reconstitute these. Things are always changing though. Please always follow the label on your prescription. Always follow the directions of your medical provider. This video doesn't constitute medical advice. Obviously I have to say that, and there's no patient-provider relationship formed unless you've already been seen by us, and therefore I defer to that. So first off, this medicine here that we're reconstituting is pentadecaarginate. So you're going to get a few different things in the mail. You're going to get a bottle here. It's going to have information on it. It's going to tell you how much to draw up here. So this one here says draw up 7.5 mLs. If you can see that here. Reconstitute with 7.5 mLs. I'm reading it backwards here. Into that water. So say it here on the bottle exactly how much to do that there. I'll show you what that means here in a second. You'll also get a bag here that kind of goes over that too as well, depending on the pharmacy. It'll come in the medication. So you're going to get a needle with a syringe with a needle, sorry. And then also this what's called bacteriostatic water. This is the stuff you're going to draw up. So when it says 7.5 mLs, 7.5 milliliters, also known as 7.5 cc's. So a cc is an ml, same thing. They're talking about this bacteriostatic water. Okay. First things we're going to do, we're going to take with the bacteriostatic water. We've washed our hands, we've prepped these things, so that's the first thing you do. They also come with alcohol pads. We're going to take the alcohol pad, we're going to rip it open. We remove the cap from the bacteriostatic water. This purple cap was here. We ripped that off. We're going to wipe this off again. Let that sit for a good minute. We've already done this, by the way, so we've already let it sit, but we're going to do it again. Then also for the your medicine here, the pentadecaarginate, it's not going to have a thing on the vial. It's going to be on the pill bottle that it comes in. You're going to wipe it with alcohol again. Ooh. We're going to rub our alcohol swab on the tip and rub that aggressively. What we're doing with that is we're killing off anything that'll be living on the top of the cap. Very less likely to have anything in there, but that's what we're doing. We're doing that. We're going to open up our package of our syringe. This doesn't take very long here. Again, this is what you do to mix the medicine. This is not drawing up and giving it to you. So this thing is not for you to give yourself, okay? Those are what the insulin syringe is for. Those are very small. And so, again, 7.5 mLs. So here, you'll see, is the 7 and the 8. And right in between the 7.5, you'll have to look at the ticks here. So each tick mark, there's 5, so it's going to be 2.2 per tick mark, 2, 4. So right in between the 4, so basically the second and the third. So what we are going to do is draw up more air than we need in the syringe, okay? You take that air into this vacuum container, and then you put your needle in the cap, right? And you put the air into the vial, and then you flip your vial, because it's under pressure now, so pull that vial down with the needle tip in there. And so you draw that up here. We're going to get more if you can see that coming in. I don't know if you can see that coming in. That's 7, so I want to make sure I get more than 7.5. So I'm going to have fluid up here. Let's see if I can do this backwards. Tap up when you see us tapping something. Making sure I'm seeing a reflection. We're gonna push this up here. We want that water right there, all the way to the air bubble all the way to the top. That air bubble is what we're pushing out. And I'm just making sure I'm getting. So you're having the bottom of the plunger, so you're going to have a dome part. The dome part's not what we want to mark. It's the top part of that black part right there, if you can see that at all. That is how much we want of that fluid that we'd inject into our bottle. For example, this is pentadeca. Okay, so we take that, put that needle into there, and all that's going right into there. Okay, way to remove our needle. We'll recap it without putting our fingers in the way. Shake this up. Ooh, yeah. Okay, now you have your medicine. That powder is now water reconstituted. That needs to go into the fridge, back into your pill bottle, so you know exactly what it is marked, and the instructions on the pill bottle too as well, so it tells you how much to inject, as we've already seen. Anywho, appreciate your time. Always can contact us at saphealth.net. You can email us anytime at staff@saphealth.net, or you can text or call us at 913-335-0152 for new patients. For existing patients, you know you can use our secured messaging service, which is HIPAA secured. You can message me anytime. That's part of our concierge service. This video is to help you, and so I hope that helps, and I hope you guys have a great day. And remember, SAP Health, where science meets wellness. We're using functional medicine along with Western medicine to make people feel better using things that aren't available to all. So we want to make sure we can do that and make people feel healthier and better. Anyway, you all have a great day. Thanks for your time. I'll see you later.